After 18 years of more downs than ups, Beth McDonald is enjoying time with her daughter Danielle. Beth's battle with chronic pain began when she fell 4 feet off a stepladder and tore a major nerve trunk in her left ankle. In spite of having been a gymnast as a young woman, Beth was left with burning neuropathic pain that radiated up her left leg.
The burning started to go up the left leg, which made it contract at the knee and the left hip, which left my knee in my chest for 5 years. They told me I would never walk again. I did 16 years of gymnastics on my legs, and they told me I would never walk again. It was the most devastating day of my life.
Over the years, Beth sought help from 145 doctors and endured more than 30 major surgeries, including the amputation of her leg.
After the leg contracted all the way into my chest, I was wheelchair bound and looking at the ground. They took the leg off, and then I could sit up a little better, but the burning never stopped.
Beth was taking large doses of prescription pain pills, plus doses of liquid morphine, yet still the pain continued.
I was on so many medications that I didn't know where I was, what I was doing, or how I got there.
Fortunately, Beth did not give up. Her search for help eventually led her to an interventional pain specialist, Dr. Jeffrey Wong. He consulted with orthopedic surgeon Dr. Grady McBride, and both physicians agreed that Beth would be a good candidate for neurostimulation or spinal cord stimulation therapy.
She was a basket case, basically. Just the kind of person that has been through so much stuff and multiple surgeries, and really at her wit's end, both physically and emotionally.
Neurostimulation therapy involves placing a small device just beneath the skin and connecting it to electrical leads that are placed in the epidural space. The leads emit mild electrical pulses to interrupt or mask the pain signals as they travel to the brain. The therapy is typically done in 2 phases, with the first being a temporary evaluation where the patient experiences the therapy during a trial period. If the patient and physician feel the therapy is successful, the patient then moves forward with having the permanent device implanted. Because the leads are temporary, patients must follow precautions after receiving a trial system. In general, patients are asked to avoid activities that could cause the leads to move, such as reaching, bending, stretching, or lifting anything heavier than 5 pounds during the evaluation period. Physicians' instructions regarding acceptable activities and caring for the bandaged area should be followed.
Dr. Wong had done a test stimulation on her and had some very promising results. And you never really know. You know, are you going to be able to reproduce what you did as a trial and go on with a permanent and get the same results? Sometimes you don't get the same results.
I did a 3-day trial. I came out of that trial surgery with no fire. It was gone.
Beth's trial experience with the therapy was viewed as a success, allowing her to move forward with the permanent implant procedure. Patients are alert during parts of the permanent procedure, thus allowing physicians to interact with them to determine if the stimulation is working to address their pain. The procedure is typically done on an outpatient basis. Because the placement of the system requires surgery, complications are possible. These can include infection, paralysis, severe bleeding, and persistent pain, numbness, or weakness at or around the implantation site. Additional complications could occur, such as allergic reactions to the device.
I expected that it would be one more procedure that would leave me on fire. And I would be right back to more morphine and more medications than I could ever take. But it was gone. The burning was out. There's so many firsts for me now. It's like starting my entire life all over again. It's being able to live all over again. You get your life back, It's being able to smile and go out and enjoy the sun and the heat from the sun and the wind that blows through your hair. It's having life back again.
If you would like to learn more about neurostimulation, visit poweroveryourpain.com to access these resources. This story explains the experience of Beth McDonald with a St. Jude Medical neurostimulation device. These results are specific to the individual featured. While most people experience at least some reduction in pain, the amount of pain relief experienced varies by individual. The surgical placement and/or use of a neurostimulation system pose certain risks. The occurrence of these risks also varies by individual.